Let's talk now about substance dependence. And when we think of abuse and dependence, we're more thinking about the impact that the drugs have on our lives. When we think about substance abuse is nothing more than a maladaptive pattern of drug use that usually leads to several things. For example, every time you use, you get in trouble. Every time you use, you get in dangerous situations, and you keep on using. This is not someone who goes out on a weekend and goes binge drinking and never drinks again. This is someone who drinks every weekend. Every weekend that they drink, they get drunk. Every time they get drunk, they drive. And every time they drive, they get pulled over and get a DUI. So that's what substance abuse is all about. What's essential is that it is a pattern. Now, once you have the abuse, that eventually is going to lead in, or possibly lead in, to what's called substance dependence. So what is crucial that you understand is that dependence typically starts off with abuse. So this is a patient who has tolerance. This is a patient who basically has withdrawal if they remove the amount of drug that they use, or they actually stop the drug use, and now the drug is monopolizing all of their lives. So they basically have lost control of the drug use. You spend most of your time looking for the drug, using the drug, thinking about the drug, and also talking about the drug with your friends. Not only are you using the drug, but because of the drug, you are going to have problems in your home life, your work life, as well as your social life. And if you stop the drug, then of course you will see the signs and symptoms of withdrawal. Now, some of the risk factors associated with this could be a family history. Now, everybody knows that substance abuse is genetic. When you look at the alcoholic studies, we know that if your parents are alcoholics and they have twins, then those twins, if they're raised by non-alcoholic parents, are 4 times more likely than the general population to have problems with alcoholism as well. If you look at the father, if he's an alcoholic and he has a son, then the son is at increased risk to develop alcoholism as well. So there is a fact of genetics with alcohol abuse. As well as physiology, certain individuals cannot tolerate alcohol, so therefore they always get sick. Asians, for example, lack an enzyme or have deficiencies of an enzyme called aldehyde dehydrogenase. So when that occurs, every time they drink, they get sick. So therefore, they never build up tolerance and they never have problems with alcohol because they don't become the habitual drinker. So again, physiology could play a part in the risk factors. As far as developmental history, that also has a lot of features. If your parents are never there and all that's there is the bottle of liquor and you have control of the house, then of course you're going to start drinking. So poor parenting could be a part of it. If you've had any physical abuse, if you've had any sexual abuse, what if your parents are cool whether or not you use drugs and they personally don't care? Then are you more likely to use drugs? Research has shown that you probably are. So again, these are all the features that could go into you becoming an alcoholic or a drug user. As well as environmental risk factors are also present. Certain groups of people have an increased risk of drug use. For example, certain occupations among physicians, anesthesiologists and psychiatrists tend to have the greatest amount of drug use. Also, what if all of your friends use alcohol or drugs? Are you more likely to use drugs because of peer pressure? That's also a contributing factor. Economically disadvantaged makes you drink. You have nothing else to live for, nothing else to do, so of course a lot of people will resort to alcohol and or drugs. And being alone, you have social isolation, you have no one to talk to, so the only friend you have is, of course, the bottle. As far as psychiatric disturbances, individuals who have conduct disorder, ADHD, even depression, will be an increased risk for drug use. Also, those individuals that don't feel good about themselves, and the only way they can feel good about themselves is when they use drugs to make themselves feel happier. The self-medication hypothesis is what I was explaining to you when we discussed bipolar disorder. So here you have individuals who have psychiatric disorders, but because of the psychiatric disorders, instead of using medications, they're regulating their moods with drugs and or alcohol in order to alleviate the symptoms. So the bipolar patient, when they're depressed, will use cocaine. And when they're manic, they'll probably use alcohol in order to calm themselves down. Now, if we look at prevalence rate, we know that alcohol is the most widely used substance in the United States. Approximately 5% of the population or problem drinkers, whereas drug abuse is much less, so it's about 3 million people in the United States. The highest prevalence of substance abuse will be in young men between the ages of 18 and 22, and if you remember those years, those of course were the years of college. Think of all the college parties, the keg parties, etc., and that's where you see a lot of drug and alcohol use. But this doesn't translate into these are the same group of men that will become alcoholics, because in reality, a lot of them just use alcohol during college and then that's it. Also, if you experiment with gateway drugs, they think that increases the risk for you to use drugs in the future, and what they refer to as a gateway drug will be the use of marijuana. So if you use marijuana early on, you're more likely to use other substances in the future. When you assess someone who has a diagnosis of substance abuse and/or dependence, again, as I was telling you, always wonder if they're telling you the truth. When you ask them about drug use, they're always going to deny it. I don't drink, I'm not an alcoholic. So it's very important that you try to get information from other people. If you can talk to family, if you can talk to friends, if you can talk to coworkers, that would be excellent as far as getting as much information as possible. You want to find out about their family function. How is it in school, if they're of school age? How does their work relationships, how are their work habits? What happens with their friends? Do they go out with their friends like they used to, etc. You want to find out what they use, when they use, what happens when they use. And also, one of the tests that's very important for alcohol is the CAGE test. And they say that if you answer 2 yeses to this, you are definitely an alcoholic. So CAGE is C-A-G-E. So C, of course, stands for have you ever tried to cut down on your drinking? A stands for angry or annoyed. Do you ever feel angry or annoyed by what others say about your drinking? G stands for guilty. Do you ever feel guilty about your drinking behavior? And E is, do you ever use alcohol as an eye-opener? So this is a good tool that you could ask your patients, and if they answer 2 yeses, then you definitely know that that individual is an alcoholic. So once you get all this information, one of the things that you should also look for is when you do the physical exam, these individuals are also going to have other evidence of the substance abuse. If you give a substance abuser the choice between food and drugs or alcohol, what do you think is always going to happen? They're going to choose the drug and alcohol over the food. So you would expect these individuals to have poor hygiene. They'll probably have poor nutrition. They'll probably have poor dentition. They might have other medical problems like cough, or again, based on what drug they'll use, you might see the physical evidence of the specific drug use. So if they use IV needles, then of course you'll see track marks. You want to make sure that these individuals also do not have any self-inflicted injuries or accidents, and always look for substance intoxication and substance withdrawal. Now, what are the diagnostic tests that are useful to determine whether or not these individuals have problems with substances? First of all, you want to make sure that you test their blood for alcohol, or you check the urine for a drug screen, and of course you might also do a breathalyzer. So this is a very quick test. They breathe into this little machine, and that will determine how much alcohol they have in their system. Another test that you could do if you have a high index of suspicion is that you can test the hair. However, this is not routinely done since it is very expensive, so it's only reserved in those cases where it's usually work-related and the employers are very suspicious of the patients and they don't think that their tests are reliable, because what happens a lot of times with these individuals, if you have to bring in a urine sample, these patients will ask someone else to give the urine, so they bring a friend's urine instead of their own urine. So it's very important to always have a high index of suspicion. If you suspect that the patient is an alcoholic, then check all the liver enzymes, SGGT, SGOT, SGPT, and you could also check for the LDH. Also, if they have been sharing needles, then you might wonder whether they have HIV, whether they have hepatitis, or any other of these diseases which can be transmitted via that route. So what is it that these patients typically complain of? They're going to have a lot of anxiety, they're going to have a lot of depression, and of course, severe amounts of emotional turmoil. What you'll expect to find is that their lives are going to start deteriorating. Their home life is going to start falling apart, their work life is eventually going to start falling apart, and everything around them will be falling apart, where they're now left isolated, no job, no friends, and all they have is the drug. When we treat these individuals, what we try to do is get them into what are called prevention programs. And there's various prevention programs. For example, specifically geared for teenagers, peer pressure is extremely important. So what you want to make the teenager is feel secure in saying no. And that's basically the slogan for teens. Just say no. Make them feel okay saying no to friends, saying no to anybody else who tries to give them drugs, offer them drugs, or make them use drugs. The teenager has to feel secure that he won't be thought of as some weirdo because he's not accepting these kind of drugs. Substance detox is the first thing that you should do when patients come in intoxicated. Why should we detox them? We're going to detox them to make sure that they're safe, then make sure that they go through withdrawal in a safe environment. So usually detox facilities are in the hospital. And in detox facilities, they're going to give you medications that help you through the withdrawal. They're going to be safe facilities. They're going to provide reassurance. And if you have other medical conditions, they will accurately diagnose them as well as treat them. Once you have passed detox, which on the average is anywhere from 5 to 10 days, then they will refer you into what are the rehab programs or the rehabilitation programs, which usually are 28 days and up. And in these rehab facilities, of course, you're going to focus on not using the drugs, and you're going to learn what are called relapse prevention techniques. And what these relapse prevention techniques will do is that they will help you identify your triggers. Every person has a trigger for their drug use. If you're an alcoholic because you're a bartender, and when you are at work, that's when you drink, then your relapse prevention technique would probably be find yourself another job. If you're a bipolar disorder patient and you drink to regulate your moods, then for you, your relapse prevention would be to identify the signs and symptoms of depression, identify the signs and symptoms of mania, and get proper treatment so you do not have to resort to drugs. Also in these rehab programs, you're going to have self-help groups, sort of like AA, NA, where you are among a group of peers and you're going to learn coping skills as well to stay clean and sober. Now there are various treatments, pharmacological treatments that will help the substance abuser stay clean. For example, disulfiram is anti-abuse, and disulfiram is a behavioral modification technique. It's called aversive conditioning, and what disulfiram does is that it inhibits aldehyde dehydrogenase. So when the person drinks, what you have is a buildup of acetaldehyde, which is toxic. So every time they drink, they get sick. So you will eventually pair drinking with getting sick. So you hopefully will learn that drinking makes you sick and you will never drink again. And that's one behavioral technique that is done in order to treat alcoholics. Another technique is giving the alcoholic naltrexone. Now they believe that naltrexone is working in the reward center of the brain. And what naltrexone does is that it stops the pleasurable effects of the alcohol. So when you drink, you basically do not get the same euphoria, you don't get the same feeling from the alcohol, so you eventually stop drinking. So this is more a trigger to stop you from using because you don't get the pleasurable effects of the alcohol. Methadone, as well as the long-acting levoalpha-acetylmethadol, or LAM, are also long-acting opiates, and what they do is that they switch the heroin to methadone and then gradually take you off the methadone over weeks or months, and it's going to be done so slowly that you should not be aware. And this is a technique called fading, where you gradually reduce the amount of methadone until you are methadone free. Now, what are the complications of all of these things? Of course, you can have certain amount of deviancy because if you can't afford the drugs, a lot of chances are that you might steal or do anything like that in order to get the drug. You can have depression, you can have CNS damage, and of course, you might have accidents because you are doing things while you are under the influence of the substances. Let's look at specific drugs and some of their characteristics. Nicotine, 25% of the U.S. population uses nicotine regularly. So about 1/4 of Americans will smoke on a regular basis. Alcohol, though, is the most commonly abused drug. And when you think of alcohol, beer and wine are the most common, and the reason being that, of course, they are the cheapest. Marijuana is the most commonly used illegal drug or illicit drug. So that also is very common, but remember, marijuana is illicit. Cocaine is also very common. Crack cocaine is not being used as much, but cocaine, when you are a heavy user, can make you very paranoid. You become psychotic. You have a lot of panic. And again, you could also become violent. And it's very difficult to come off of cocaine. So that's why addiction is such a problem. When people start to withdraw from cocaine, they don't like how they feel, so they quickly go back to use of cocaine in order to make themselves feel better. Amphetamines are increasing in popularity. One of the reasons is that they're very easy to make. Now, there are certain groups of individuals that tend to use more amphetamines than others. For example, people that need to stay awake, people that need to stay alert. So you have truck drivers who might use amphetamines as they drive across country because they need to get to their destination quickly, and of course they need to stay up all night. When we think of opiates, we know that heroin, of course, is the most widely used. And what we know of heroin addicts or opiate addicts is that they pretty much tend to isolate themselves. And basically, opiate withdrawal is very, very painful. So what tends to happen is that these individuals will use the heroin or the opiates daily because they cannot tolerate the withdrawal. And if you can't afford it, then there's a lot of illegal activities being done in order to obtain the opiates, and that is stealing, etc. Inhalants are very commonly used, especially in the poorer parts of the country or in poorer nations, or the very young. Why? Because they're much cheaper. So what patients are doing is that they're inhaling gasoline, glue, solvents, or any kind of pain thinners. The problem with inhalants is that they basically turn your brain to mush. So you do see a lot of cognitive deterioration, which tends to be irreversible from chronic use of inhalants. PCP is usually associated with severe violence. These patients typically have superhuman strength, and they also will exhibit nystagmus. Hallucinogens come in various types. You have LSD, you also have mescaline, and you also have psilocybin. Now, nobody uses LSD on a regular basis, so this is done more intermittently. And what's important about the LSD is, what if years have gone by since you used LSD? Now you can experience the same things, and that is something called a flashback. So LSD is very common to give you flashbacks years after you've used. Now, we know that a lot of these designer drugs, for example, ecstasy, are very popular, and they're popular again. Why? Because they're very easy to use. And ecstasy, for example, is a combination of amphetamines and a combination of a hallucinogen. So you're going to have the same side effects of each one of these. And the benzos, we worry about the benzos, especially with the elderly, because you don't want to make them more confused. You know that they're going to have problems with sedation, and that's a side effect that can occur, and it also causes memory and problems. And we know that tolerance and withdrawal do occur with the benzos. Steroids, you see about 5% of adolescents using them, mostly males. The problems with steroids is that they can make you psychotic, they can make you aggressive. The date rape drug flunitrazepam is important because it's one of these drugs that is colorless, odorless, tasteless. So what happens is the female leaves her drink unattended, someone puts it in her drink, she drinks it, they take her home, they have sex with her, and she doesn't remember a thing, and that is why it is called a date rape drug. So basically it produces a sort of amnestic state. GHB also is very similar, and it produces a giddy-like type intoxication, usually lasting about 4 hours. Now let's look at the blood alcohol levels and the specific behavior. Most states have alcohol level for legal intoxication of 0.08 or 80 milligrams per deciliter. Some states have 0.1% or 100 milligrams per deciliter. So what happens to us as the level of alcohol in the blood increases? When you have a level of about 0.05%, basically your thoughts and judgments start to be loosened. You tend to be a little bit more disinhibited. This is where you step on the table, you dance on the table, and you start taking your clothes off. Why? Because now your judgment tends to be a little bit impaired. At 0.1, now is when you're having motor actions become clumsy, so you're going to have some gait disturbances. So when the police pull you over and do one of those roadside sobriety tests, if you cannot walk a straight line, they know that your level is at least 0.1, which is legal for intoxication in most of the states. When you are at 0.2, the motor areas of the brain start to become depressed. At point 3, you might have confusion and stupor, and at point 5 and above, you can have some respiratory depression, you can go into a coma, and of course, you can even die when the level is that severe. The numbers, however, mean nothing if you're a chronic alcoholic. So these numbers apply for people that do not have problems with alcohol, but there's been numerous situations where alcoholics have come in with levels of 0.4 and above, and they're talking just like I'm talking right now. And all that tells you is that that's a person who is definitely an alcoholic and they have tolerance. Now let's review the specific signs and symptoms of intoxication, withdrawal, etc. So let's start off with alcohol. What happens when people get drunk? Well, they're very talkative, they can be gregarious, or they could be sullen. So you can be the nasty drunk or you could be the funny drunk. But basically that's what happens. When you use amphetamines and cocaine, remember that these substances elevate dopamine. So what happens? You can have some euphoria, you become hypervigilant, you become hyperactive. You do have some weight loss. Why? Because it affects your appetite. So you're not eating. You'll have pupillary dilatation and you'll have perceptual disturbances, which means you can have hallucinations. So cocaine or amphetamines intoxication resembles schizophrenia, paranoid type. When you use inhalants, on the other hand, that could lead to some belligerence, some apathy. You could become assaultive. Your judgment is going to be extremely impaired. You could have blurred vision. You could become stuporous or even go into a coma. Opiates, of course, will produce some apathy, some dysphoria. You will see papillary constriction. So pinpoint pupils is usually the clue for opiate intoxication / overdose. So what you have here is some drowsiness, some slurred speech. You could have respiratory depression, you could go into a coma, and of course, you can die. And this is probably the very first one of these substances that death is possible from an intoxication. So anybody who comes in with an opiate overdose usually gets treated as an emergency because you can die from such substances. Cannabis, of course, produces impaired motor coordination. You can have a slowed sense of time. You get conjunctival injection. You get increased appetite. You can get, of course, some social withdrawal to the point that some people believe in something called the chronic cannabis syndrome or the amotivational syndrome, and they believe it's from chronic marijuana use. So basically you become apathetic, you don't care about anything. And of course you could also have a dry mouth and tachycardia. PCP, you're going to be very belligerent, you're going to be extremely violent, you're going to have a lot of nystagmus, you can have hypertension, you can get into a coma, and of course you also will have hyperacusies. But the two biggest things for PCP will be violence and the nystagmus. Benzos can disinhibit you. So therefore you can become aggressive or you can become very sexual. It will affect your memory, it will affect your concentration, and it will also produce sedation. And it is extremely addicting as well. Knowing what happens during intoxication, now let's focus on what the treatment of withdrawal is. When you are in severe alcohol intoxication to the point of respiratory depression, then you might need mechanical ventilation. But if that is not the case, what do we do for alcoholics in the hospital setting? Not much. Make sure they're hydrated, make sure they get something to eat, and you let them sleep. And the next morning they wake up, they're not intoxicated anymore, and they can go home wherever home is. The treatment of amphetamine and cocaine intoxication, remember these drugs make you agitated, assaultive, you can have high blood pressure, you have autonomic hyperactivity. So the first thing you want to make sure is that the person is okay. Put them on a cardiac monitor so they don't get an arrhythmia and die. Make sure that you treat the aggression with either benzodiazepines or antipsychotics. And of course, make sure that you treat the hypertension. And that's how you safely treat the intoxication for these substances. Inhalants, because you can become agitated or aggressive, you might want to give them either benzodiazepines or antipsychotic. Make sure that these patients are in a calm environment, dark, quiet rooms if possible. If not, medication is the key. Now, the treatment of opiate intoxication, since it is considered an emergency, give them naloxone. And naloxone will work immediately, will block the opiate receptors, and therefore prevent them from going into death. Now, cannabis intoxication doesn't require anything. There's nothing you can do. Make sure that the patients are safe, and that's it. PCP intoxication, since these patients do become agitated, they can become violent, make sure that they're in a calm, quiet environment, dark, quiet room. If the patient is in danger of hurting himself or others, then medicate them. And the way you medicate them will either be with a benzodiazepine or an antipsychotic. Now, the benzodiazepine intoxication, in reality, in the real world, you don't give them anything. But for the purpose of the exam, flumazenil is the drug of choice. Why? Because it's the benzo antagonist, so that's what you would put down on the test. Now, how do we treat the withdrawal from each one of these substances? The alcoholic withdrawal usually consists of tremors. The patients are going to have hallucinations. The patients are going to have seizures, and the patient can experience delirium tremens. Usually the peak of DTs will occur within 2 to 4 days of them either stopping the drug or reducing the amount of alcohol that they're taking into their system. Now, delirium tremens has the autonomic hyperactivity, you have seizures, you have the clouding of the sensorium, and basically it can be lethal. Less than 20% of the patients can die. So you have to be very aggressive in the treatment of this type of disorder. Now, amphetamines and cocaine in the withdrawal will produce a depressive-like state. So what do you get? Problems with appetite, problems with sleep, problems with weight. You can have anxiety. You can have some tremulousness, and patients basically can think of suicide. So suicide is the biggest risk factor for cocaine or amphetamine withdrawal. Inhalants do not have withdrawal. Opiates will produce flu-like symptoms. You get fever, chills, lacrimation, runny nose, piloerections, GI disturbances like diarrhea, abdominal cramps, muscle spasms, etc. Cannabis has no withdrawal. PCP has no withdrawals. Benzos, of course, think about what they're used for. They're used for anxiety, they're used for insomnia, and they're used for seizures. So when you reduce these drugs or absolutely stop them, what would you expect to get? Anxiety, sleep disturbances, and of course, seizures. Now, the treatment of these withdrawals, because it's alcohol, you're going to give them benzos in order to prevent the seizures and the DTs. You're also going to give them multivitamins, you're also going to give them thiamine, and you're also going to give them folic acid. Amphetamine and cocaine, you don't necessarily need to treat them in the hospital immediately for their withdrawal, but long term, because of the possible risk of suicide, antidepressants may be used. Some facilities use something like bromocriptine because it's a dopamine agonist, so it resembles the effects of dopamine, but it doesn't have the same physiological adverse effects. Inhalants have no withdrawal, so therefore no treatment. Opiates, you're going to give them clonidine in the hospital setting, and what clonidine tends to do is that it reduces the symptoms of withdrawal so that withdrawal is not as severe. Once these patients get discharged back to the community, then you refer them to a methadone clinic where they will be getting methadone, and that will be gradually reduced. Cannabis has no withdrawal, so therefore no treatment. PCP has no withdrawal, therefore no treatment. And of course, the benzo withdrawal, it's very simple. You give them benzodiazepines. Now let's review a case. A 29-year-old man is brought in by judicial order for evaluation of his continued involvement with heroin use. The man denies that he's addicted but is willing to enter treatment in order to avoid more severe criminal penalties. Which of the following is essential to determine the presence of heroin dependence in this individual? A family history of substance abuse. B, numerous arrests for dealing heroin. C, he vehemently denies that his use of heroin causes him problems. D, he spends all of his time trying to obtain heroin and can't stop himself from using. Or E, he's cooperative with treatment planning. Now, what was essential of dependence? In dependence, what you had was the individual being totally involved with the drug. He uses all the time, spends all of his time using, and of course is trying to stop. So the only one that best fits that answer will be letter D. So D is the correct answer for this question.